Welcome to today's webinar, Using Health Impact Assessments to Engage Communities and Prioritize Action, hosted by the Maryland Department of Planning in association with the U.S. Environmental Protection Agency's Brownfields and Land Revitalization Program, and the Office of Community Revitalization and the Smart Growth Network. My name is Michael Bayer. I'm the Manager of Infrastructure and Development at the Maryland Department of Planning and Project Manager for the Smart Growth Information Clearinghouse. The Smart Growth Information Clearinghouse is a project of the Smart Growth Network, supported by the US EPA's Office of Community Revitalization and managed by the Maryland Department of Planning. In addition to hosting webinars, the Smart Growth Information Clearinghouse has a website at smartgrowth.org that provides information on effective growth, development, and preservation practices. The website provides information about events, funding opportunities, awards, and resources to help local decision makers foster healthy, resilient, and economically vibrant communities. The Clearinghouse is the virtual home of the Smart Growth Network, a nationally recognized coalition of leadership organizations that have formally endorsed the principles of smart growth. This webinar is one in a series of webinars produced by the Maryland Department of Planning on smart growth and planning topics available for viewing at smartgrowth.org. This webinar is also the fifth in a series of webinars featuring the US EPA's Brownfields and Land Revitalization Program and Office of Community Revitalization, called Learning from and Leaning on Local Leaders to Revitalize African American Neighborhoods. Thank you for participating today, and we encourage you to attend the other webinars in the series and to watch the past programs at smartgrowth.org and on the Smart Growth Online channel on YouTube. The views expressed by the speakers in this webinar are those of the speakers and not necessarily of the Maryland Department of Planning or the state of Maryland. We are recording this webinar and we'll be posting it on our website under the Webinar Archives tab. We encourage you to visit the website and to subscribe to our e-newsletter to learn about our upcoming webinars. You can also find out about planning initiatives, planning tools, and educational opportunities in Maryland by visiting the Maryland Department of Planning's website at planning.maryland.gov. Viewers of this live event are eligible to receive 1.5 CM credits from the American Planning Association and 1.5 CNUA CEU self-reported credits from the Congress for the New Urbanism. To log your AICP credits, visit the American Planning Association's website at planning.org, log into your account, and search for the name of today's event, which is Using Health Impact Assessments to Engage Communities and Prioritize Action. You can also search for event number 922-6639. Today's session is going to be introduced by Carlton Waterhouse, who is the Deputy Assistant Administrator of the US EPA Office of Land and Emergency Management. So welcome to Dr. Waterhouse.
Thank you so much. I really appreciate that welcome, and I'm really excited to be with you all on today to talk about these important issues. I'm Carlton Waterhouse, for those of you who don't know, and I'm the Deputy Assistant Administrator for the Office of Land and Emergency Management at the United States Environmental Protection Agency. I'm excited to address you as a representative of the Biden-Harris administration because of the focus of this webinar, which is also very important to me, as I know it is to all of you. It's the first of 4 webinars in this series that are centered around stories told by leadership in African American communities who brought about positive change in the quality of life for community residents. We can all draw a lot of inspiration and wisdom from these stories of past success as we craft strategies for the future. You know, my own experiences in looking at the broad range of challenges facing many communities give me the perspective that there's nothing that can be really equal to or rival the power of people organized and working together to make life better for themselves and others. I've done an article looking at the work of Regenesis in South Carolina, led by Harold Mitchell at the time, and the way that they went from a community that was plagued by toxic waste sites and other challenges, Superfund sites and the open dumping sites, to a community that's now characterized as a health field because of all of the health facilities and the support services, the affordable housing that has now replaced those contaminated sites. and what a transformation it's been. I've also seen the work of people like Elizabeth Gore in Indianapolis, Indiana, where I've worked to provide leadership to her community members to face environmental challenges and to protect the health of people there who were faced with contamination from a facility that was abandoned and had left contamination in the neighborhood and in residents' yards. It really does make a difference when people engage and work together to transform their communities. And I know that in EPA, we have the ability to partner with community members like those who I've mentioned, who are on this call and those who are not, to help empower them to be able to be effective. And that's one of the things that I really celebrate and I'm excited about in terms of my work in EPA today. You know, we're living in a very exciting time. The Biden-Harris administration has really given a great deal of attention and focus around environmental justice and on improving the quality of life for overburdened as well as underserved communities. And Administrator Michael Regan, who is our administrator at EPA, shares that same set of commitments, even as I do within the Office of Land and Emergency Management. And that makes this an exciting time because I believe we can make progress to address health and environmental disparities that have existed for far too long in our society. And that work has to happen together. From the standpoint of this administration, the approach is an all of government approach. It's a matter of drawing resources across the federal government and across the EPA and the expertise across the federal government and the EPA that goes hand in hand with experts in housing, public health, transportation, with job creation and training, with economic development and other fields to work together with communities to bring about positive change, transformation, and greater economic prosperity. So how can we organize our thoughts to address these complex, interrelated environmental and economic problems in communities? Well, in many situations, people may feel overwhelmed, but this is a challenge that this administration has not shied away from rather, but has leaned into. And that excites me. And I really look forward to continuing to work with other members of the federal family, state, local partners, tribal members, and community members in helping us to address these kinds of issues. And particularly to address the issues we're talking about on today's call, which focus on the use of health impact assessments to gain an understanding of the range of challenges to community health and the tools and approaches available to us to address the causes of health challenges in our communities. You know, our challenges may be a complex mix of both environmental contamination, low quality housing, even low or poor indoor air quality, lack of jobs that have a living wage, inadequate health facilities, lack of or underabundance of healthy food choices, a lack of urban space, open spaces and green spaces, and limited transportation options. These are the reality in too many communities, and these are the things that need to be addressed. And a health impact assessment tool is a valuable tool that can really assist us in helping to get a better grasp and make sense of how these different factors relate and interplay, and how we can check them off as we address them one by one in order to really bring on the ground improvements and changes for community residents. So I'm really excited about the webinar and what's taking place and the opportunity to participate with you today on a subject that is so vital to our administration, so vital to our country, and so important to me. And I thank you all for attending and for the opportunity to address you today.
Great. Thank you, Dr. Waterhouse. So our panelists today are Ann Carroll, Sandra Whitehead, and Tim Barczyk. Dr. Ann Carroll is a senior policy analyst with EPA's Office of Brownfields and Land Revitalization. She has more than 30 years of experience on environmental and public health protection, including contaminated site cleanup, risk communication, lead poisoning prevention, and children's environmental health. Her past work has included providing technical support and assistance to lead poisoning prevention and leaded gasoline phase-out efforts in Australia, India, Indonesia, and other countries worldwide. Dr. Sandra Whitehead of George Washington University is a national expert on the implementation and evaluation of health in all policies and serves as president of the Society of Practitioners of Health Impact Assessments. She has taught health in all policies with the World Health Organization and currently manages a community of practice for academics and environmental health professionals and supporting communities across the country through technical assistance. Finally, Dr. Tim Parzik works on cumulative impacts and environmental justice as a scientist in the EPA Office of Research and Development, where he partners with residents, community organizations, university researchers, local governments, and federal agencies to find local solutions to environmental health problems. Tim focuses on ways to address these cumulative impacts by finding points of intervention and feasible strategies to make tangible changes on the ground, thereby improving public health in measurable ways and supporting long-term change through engagement and applied science. Following their presentations, our panelists will answer as many questions as time permits. You can always submit a question anytime by using the questions tool located in the control panel on the right side of your screen. And with that, we're going to have our usual, for those of you who have been here before, quick poll of the audience so that everybody can see, including our panelists, where folks are coming from today. You have 5 options on the screen. If you're having trouble responding, please exit from full screen mode. We'll give you about 30 seconds or so to respond, and then we'll close, show you the response, and then move into the presentations. So thanks everybody for being here today. And as usual, we have a nice representation of people all across the country, as well as outside the US. So we'll just leave this open for a couple more seconds. Okay, so today 32% of the audience says they're in the Mid-Atlantic or Northeast, 26% in the South, 20% Midwest, 16% in the West, and 6% international. So with that, I'm going to go ahead and turn it over to Ann Carroll so she can begin the presentation. Welcome, Ann.
Thank you. Thank you so much for having me today. I'm really excited to be here, and I'm especially excited to introduce and be a part of a panel with Dr. Tim Parzik and Dr. Sandra Whitehead. And thanks all of you, and I apologize in advance. I've tried to get out of Teams and it seems to want to continue to pester me. So advanced apologies for that. So we're here today to talk a little bit about health in communities, to follow up on what Carlton Waterhouse said, and really highlight ways that in the Brownfields program and in other kinds of community development and economic revitalization efforts, we think about health, and really to introduce health impact assessment as a fabulous tool, both for stepwise engagement and conversation with communities as they're working on their own reuse vision and their own revitalization. So before we really introduce public health and health impact assessment, let's talk about health. So I'm using the most comprehensive definition here from the World Health Organization, and that is that health is a dynamic state of complete physical, mental, spiritual, and social well-being, and not merely the absence of disease or infirmity, something I think we all realize that we have benefited and need more of in the last couple of years. Public health, as our Institute of Medicine with the National Academy of Science defines, is what we as a society do collectively to ensure the conditions in which people can be healthy. And so you can see why this is a central core interest of the EPA as well as the Brownfields program. And so when we talk about health in this country, often what we're really talking about is medicine. And we're not necessarily contrasting that what medicine does for one life at a time, public health does to focus on millions at a time. And so that's where those community conditions really play into health, not just what is the issue of an individual brownfield site, which you are seeing in front of you, but also the broader ramifications of the deindustrialization of those former industrial areas, the disinvestment when a company closes and people no longer have jobs, that's a loss of local tax base. The abandonment that results in an economic erosion, a physical decline, and the social isolation of those that are still there. So in the Brownfields context, because we wanted to have a better understanding of the community characteristics, some internal EPA analysis looked at brownfields and what were the populations nearby. And for those of you who might have been thinking, well, there are no brownfields in my community, as you can see, there are in fact brownfield sites around the country. And what we found is the closer you look at a brownfield site, the more you see that there is a minority, a low income, and a population that is less likely to have high school education. And so that really speaks to the multidimensional environmental, public health, and social issues that we are trying to grapple with communities as they're tackling brownfield sites. So what is a brownfield? You've already seen one rather graphic example. This is just a couple of different examples that you will see around different parts of the country. And so the example I usually bring to mind, because every community really has one, is that corner gas station that's abandoned. But it could be the dry cleaner in the strip mall, where solvents might have been spilled. It could be that power plant or manufacturing area, or that railroad spur. The point is there are many different kinds of sites and past industrial, commercial, and even residential or abandoned area uses that have resulted in brownfields that required cleanup. And of course, the concern of the community and the concern of the EPA is what are the environmental contaminants that are commonly reported at those brownfields? And this is really just our top 8 that are reported to the EPA, which probably are not a surprise to you. Lead, petroleum, asbestos, those incomplete products of combustion, polycyclic aromatic hydrocarbons, other metals that are used in certain industries, VOCs, those volatile solvents that might be used at dry cleaning, but also in cleaning materials, PCBs at that power plant. They were used in transformers as a dielectric fluid, and then arsenic, another metalloid that is common in areas where there are brownfields. And so the concern of the community and the EPA is, how are we exposed to those contaminants? Are we accidentally breathing it? Could we be eating or drinking it? And if we walk by it, could we have some kind of direct contact through our skin? And so those are some of the things that communities that have brownfield challenges are grappling with. And that's where the EPA Brownfields program really helps to walk them through this stepwise consideration of those kinds of contaminants, where exposures might occur, and how those materials can be reduced and exposures reduced so that it can be safely reused. And so in addition to those site-specific health considerations, we encourage communities to think about a community health assessment, because as we've mentioned, there are the individual site issues, but there might be those rippling other effects that a brownfield grant can help a community consider, talk about, and possibly even solve in the course of their brownfield revitalization and public outreach and community conversations. Health monitoring is something we encourage communities to do, working very closely with their public health agency where they believe there could be a hazardous material exposure and there might be some health consequences for the people in the community. Now, we have had so many exciting community health leaders. You heard Carlton Waterhouse talk about Regenesis and the community turned into a health field. That's nomenclature we've used really to highlight how those community champions have not only tried to tackle that brownfield, assess it, clean it, and make it safe for reuse, but purposely think about how that reuse can advance and improve public health. And in some areas that has been putting a community health clinic in a medically underserved area, as in the area where Regenesis was active. But also in a food desert area, could there be a grocery store, supermarket, or farmer's market that would give people access to food? How can we improve and expand safe and healthy housing, as well as create recreation and green space? And so, as you can see, the advantage as we're thinking about public health in brownfields practice in a host of different ways, health impact assessment provides a well-accepted, stepwise tool that really helps the community systematically think about health, expand the conversations, and bring new people to the table to talk about what are their health concerns and what are the ways that a redevelopment or revitalization can actually improve public health. And so in the EPA Brownfields program, because I'm hoping to turn all of you into Brownfield practitioners and ambassadors by the end of this webinar, we both give direct grants to communities that apply through an annual competition, but also we provide indirect technical assistance. There are third-party entities that may be more approachable and communities can seek assistance from them, as well as their state or tribal program, or they can come directly to EPA for both technical assistance or targeted brownfields assessments. We also encourage people who are interested in brownfields to attend our National Brownfield Conference, as well as our workshops and webinars to learn more and figure out how they can green space, which we will know all of our communities that we're trying to make more resilient will be seeking to do. Mixed use redevelopment to strengthen that infill redevelopment and reduce sprawl, as well as increase residential, especially affordable housing, and even industrial reuse. So the Brownfields program doesn't do this alone. It is so much in community partnership. And so because of that partnership, it has yielded a great deal of different benefits for communities, environmental and public health, social and economic. And the EPA Brownfield grant money really is seed money, because every $1 of EPA Brownfield grant funding has leveraged $20 in public and private finance. And each of those $100,000 is actually creating 10 or more jobs. And so that's something that we're very excited about, as are the communities that are championing these efforts. The other thing, of course, is by redeveloping that infill area, you're preventing the creation of other new impervious surfaces in exurban areas. And then the air pollution that might be associated with any vehicle mile traveled to more exurban or rural locations. So in closing, efforts, as well as minimize environmental and public health adverse impacts. So with that, I will go on mute, apologize again for Teams, and turn it over to Dr. Sandra Whitehead.
Thank you, Dr. Carroll, and thank you to EPA for having me here today. I appreciate the opportunity. I'm Sandra Whitehead. I am a professor and program director of the Sustainable Urban Planning Program at George Washington University here in Washington, D.C. I am also an HIA practitioner and a member of the National Environmental Justice Advisory Committee for EPA. Part of my current role also involves being the president of the Society of Practitioners for Health Impact Assessment. And or Sophia, as we call it, is really a community of practitioners who share resources. We run a community of practice. We conduct HIA trainings. We create tools. We provide peer support and mentoring for new practitioners, or review and evaluation for existing practitioners. And we also have created and are in the process of updating the minimum elements and practice standards for HIA, which establishes the North American practice of HIA and gives you a guideline and a tool to know if your HIA product or project is meeting the standards of HIA. We are in the process of holding our annual practitioner workshop. Tomorrow is the second day from 11 to 1 o'clock Eastern. We'll be talking not just about the future of the practice of HIA, but also HIA-like approaches and tools and frameworks like health in all policies. It's only $50 for the online event. But the reason that I brought up health in all policies is because health departments, as much as they would like for us to all behave health promotingly and do all of those things that Dr. Carroll described as public health, it's not possible in every neighborhood for every person to live a healthy lifestyle. There are so many neighborhoods where we talk about making the healthy choice the easy choice. We have to start by making the healthy choice the possible choice. Your zip code determines so much of your health outcomes, your parents' employment status, the type of housing that they could afford to live in, the kind of water that you drank as a kid. And, were there parks available? Were there sidewalks in your community? Did you have to go everywhere in a car? All of these factors we call the social determinants of health. All of these contribute not just to your immediate health, but to your long-term health. And most of them are outside the purview of public health. Things like city planning, like what I teach, or transportation planning, right? It's great whenever people tell you, oh, walk a little bit more every day, try to get some exercise. But if you live in a neighborhood where it's not safe to walk, or there are no facilities for walking or resting or shade trees, that is going to contribute to your limitations on taking control of your own health. And communities' most pressing problems come from some of these challenges, right? The things that require a systematic approach and tools to address them. They're not just one thing. You can't just talk about sidewalks. You have to talk about connectivity. You have to talk about people's willingness to walk and neighborhood safety and perception of safety. You have to talk about the kind of trees that are available to shade people in the summertime. So there are a lot of these things are tied to bigger community issues, the allocation of municipal resources, the remnants of redlining, the structural racism that has been baked into our planning systems and the community systems for funding amenities. All require a more systematic approach. And HIA can give you that tool. Because HIA is a systematic process. There are 6 distinct phases in the HIA process, and there's a very good description and a very good established practice around what those phases are and how you go about them. There's also it uses a bunch of different kinds of methods and data sources. We're really interested in HIA and understanding the perspective and the lived experience of the people who are going to be impacted by the decision that we're looking at, whether that's a policy, a project, or a program, right? Any of these things, you're going to be looking at them ahead of time before they're established with the HIA. So it gives you this opportunity to apply data sources and systematic methods to work with stakeholders to understand both what is important to the community and for them to understand how this decision may impact their health. So you're really looking at not just what are the possible health impacts, but how are those distributed across the population and across the geographical area. But the thing that really makes HIA compelling is that it provides an opportunity to make recommendations to both ameliorate any negative health impacts and to enhance positive health impacts. One of the reasons that I really think that HIA is an important community engagement tool is because of our values. Whenever you think about how does a process roll out into a community? Really, HIA at its core and by design promotes democracy. It has a very strong community engagement process. Equity. Equity is at the root of why we do health impact assessment. People used to talk about health inequities, and now we're able to talk about health and racial justice. And it really is a much more freeing way to talk about the implications of equity. This increased awareness of health issues. People will say, oh, you're trying to be a health imperialist and make everything about health. Well, why not? Everyone understands and values health because they have it themselves or they don't have it. And if we can use health as a springboard to talk about some of these larger issues, then it makes it more relatable and it makes it more likely that we're going to be able to affect change. Scientific and robust practice, using data, using not just the methodology of public health to look at processes and impacts, but also pulling from other disciplines, pulling from not just public health, but from planning, from engineering, from systems analysis, from risk assessment. There are a myriad disciplines involved in HIA that you wouldn't get with just a regular health assessment. These are the phases of HIA that I mentioned. It starts really with screening. Is it necessary to do an HIA? Scoping, how big is this thing? Which health impacts are we looking at? Is it just this one policy or the whole plan, right? What does it look like? And how are we going to examine it? How much are we going to engage the community? How much data are we going to use versus lived experience? Assessment. How are we going to go about assessing it and making sure that we have heard everyone who needed to be heard, that all the stakeholders were at the table, but also that we have thoroughly analyzed the options and created recommendations. And then reporting it back not just to the decision makers, but first to the community to make sure that our analysis resonates with them and to make sure that it's reflective of their values and the changes that they want to see in their community. And then evaluating our process. Did we do what we set out to do? Was it impactful? Was it effective? Did we really help the community articulate their issues and reach an understanding with the decision makers that at least brought health into the discussion and created new partnerships? And then monitoring. You monitor over time whether the impacts you predicted came true. And that's just a little snapshot of how it works. And Tim's going to give you some concrete example in his presentation. I mentioned that we're identifying harms and benefits before the decision is made so that you have strategies that are based not just in the evidence, but in the will of the people through this inclusive process. And it also, HIA also gives you the tools to support and empower communities to help them gain the experience with gaining process justice, with getting into these processes that are not always clear to communities and having some say-so over what happens to them, but doing it with them. And it also ultimately has the outcome of advancing health equity. it provides a framework to solve real world problems, looking at the impacts of climate and climate change and how that impacts your community, how it impacts the community of people who are least likely to be able to respond themselves. Looking at the legacy of redlining and how do we create more just policies around land use and municipal resource allocation, where the parks go, where the sidewalks go, who gets street trees. You can use it to look at issues of cumulative environmental injustices. Many communities don't just have one paper mill. They have a paper mill and a solution plant and a dump and a recycling facility. At least the neighborhood I grew up in does. You can also use HIA to address vacant lots and redistribute those resources within your community and influence the policies that your local government may have. And creating economic opportunities, maybe examining different scenarios for economic redevelopment, tagging into a brownfield redevelopment to create more opportunities, not just for new people who might want to move into your community, but also for the people who are remaining there. And HIA has been used quite a bit in recent history, maybe the last 5 years, to look at educational quality and to really assess different policies around keeping children in school, getting children into school earlier. Nevada did an HIA looking at the value of free kindergarten and preschool. So this is a very versatile tool that you can use, and community groups can use it. You don't have to have special training to use this tool. There are some challenges though. You know, while health is valued, our decisions, the public decisions, aren't always framed as health decisions, so it's hard to get a seat at the table. Current indicators, it's really hard to tell if you've impacted public health overall with your recommendations, because it's so multifactorial, right? There's so many things that can cause you to have ill health that aren't within your control. And there aren't really reporting requirements to address equity or report out on changes, although that's changing. Many communities have begun creating health equity plans or climate justice plans, or they've incorporated it into their comprehensive planning process. So these things are getting better, but the biggest challenge is funding for HIA. And I will let Dr. Carroll talk to you about eligibility in Brownfield programs for funding. And with that, I will turn it over to my colleague, Tim. I've provided some links to the organizations that I'm a part of in the chat, and I really appreciate the opportunity to speak today. Thank you.
Thank you, Sandra. Thank you very much, everyone, for sharing your time today with us. I'm very grateful to be here with Ann and Sandra to be able to talk about HIAs. And I'm going to speak a little more on the practicality of HIAs during project planning. So we've heard that they can be applied across various sectors and different areas and through different approaches. So I'd like to talk a little bit about how are they implemented during project planning. I'll be using some examples from a recent HIA conducted in Rockford, Illinois, during some of their neighborhood revitalization plans. So the city of Rockford recently had received technical assistance from the EPA to design a neighborhood revitalization strategy for one of their neighborhoods in the South Main corridor. And so their revitalization plans, as they were moving forward, really aligned with these HIA concepts that EPA had been exploring in some of their research efforts. And so we kind of thought, could HIA be applied to some of these revitalization plans that they were undergoing? Because they had a very broad view of health. And they wanted to look at multiple different aspects as they move forward with engaging developers and investors and speaking with the community about their values and priorities in terms of investing in this area. how could they better inform a wide scale benefits to the community, as well as to facilitate project planning? So we went ahead and applied a rapid HIA. So there are different complexities of HIA, from much more screening level ones to very comprehensive ones that one can work through. And I think that's important to keep in mind too, is sometimes you have to make the HIA your own. Within our HIA, we use a variety of methods, including qualitative and quantitative analyses, GIS mapping, literature reviews, and this was conducted over 2019 to 2020. So our stakeholder input was a little varied from what was traditionally done, and I'll talk about that in a little bit. But regardless of the time and complexity you put into your HIA, they all are intended to follow the MEPS. And you'll be hearing much more about these, is why I didn't define it. But these are the minimum elements and practice standards. It's only 10 pages long, think of that. It's a 10-page manual on how to conduct an HIA, and it walks you through those steps that Sandra mentioned. But that's all it is, 10 pages. So you might beg the question, what essential elements constitute an HIA? What makes this different from these other assessments that I keep hearing about? How do we make sure that it ensures that health and equity are considered? Well, HIA is founded on these minimum elements and practice standards, which actually are currently undergoing an update, and you can check the SOFIA website on the progress of those. But the minimum elements are kind of the principles of an HIA. They're really meant to establish what you really intend to do in the big picture. And there's only 8 of them, so they're very tractable. A couple of them here, one very important one, as mentioned already, is that it systematically considers a full range of potential impacts on health. It also provides recommendations on feasible and effective actions. So there are some very key terms within these minimum elements and subsequently the practice standards that should really guide one's thinking during the application. And I'd like to remind folks that HIAs conventionally begin with a decision that you're considering, a program, a policy, a project that you're developing, and you want to assess what are the potential impacts of that policy. So in the environmental arena, things like industrial facilities inevitably impact way more than air, water, and soil quality. A whole host of impacts could occur, including economics, education, housing, land use, traffic safety, mental health, noise and light pollution, mobility and access to goods and services. And often there's only a first order look at the impacts that are most directly related, but there are direct and indirect impacts, near term and far term. For many of the decisions that could be considered, and HIA is adaptable to be able to investigate those in depth. So once you have the principles established, but how should you actually conduct it? How should you take that first step into performing an HIA? What are the benchmarks that you'd be looking for in terms of the information you're collecting and the quality behind it? Well, that's where the practice standards come in. So these are some general standards for the HIA process. Again, a limited subset, and these are just meant to guide your overall thinking as you work through the steps. But some of the important ones overall are that the HIA should be responsive to the needs and timing of the decision-making process. If you're not conducting the HIA and completing it to a significant fashion before the decision is made, it can be difficult to inform that decision. But it's also meant to have meaningful and inclusive stakeholder participation in each step. So engagement is right at the forefront of this. And remembering here too that engagement, stakeholders could be anyone affected by the decision. It could be the community, it could be a local agency, a decision maker, any public, private, government sector who might be impacted as a potential stakeholder and should be considered in terms of engaging them within the HIA. So starting right off the bat in terms of the screening step, this is really meant to kind of look at, is an HIA warranted for this decision? Does this decision have the potential to impact health so that we should look at it? And there are a few other considerations. Do we have the capacity to really undergo this? Or what capacity do we have, and how could we scale the HIA to make sure that we can achieve it? Many HIAs will largely sort of forego this, taking it for granted that a decision is impacting health, and move right into the scoping step. And that was kind of similar for Rockford. We knew that this large-scale neighborhood revitalization strategy was inevitably going to impact public health. This was an industrial community. In the early days of its founding, it had a very large furniture manufacturing facilities as well as machinery complexes. It was also very well known for baseball, and the women's baseball team was featured in a league of their own. But like Ann mentioned, similar to many industrial cities, it went through de-industrialization, disinvestment, and abandonment, and now it's in a situation where there are many aspects of it that could be considered during the revitalization process. So within the scoping is to develop that stakeholder engagement plan. So how are you going to engage people, and at what level? And that's a very important consideration too. There are different levels of engagement, and each stakeholder may have a different approach. But also during scoping, this range of health issues should be examined. So right away, begin the brainstorming process on how this decision might impact people's health. In terms of Rockford, some of their main priorities revolved around housing conditions, the neighborhood and built environment, parks and green space, employment and economy, crime and safety, and social and cultural well-being, all of these with a focus on mental health. And I should add here that this HIA was a little different because we weren't focusing on like a specific decision, like should we redevelop this parcel of land? Should we invest our money in this type of mitigation process? This was a broader type of approach to HIA. And there too, we had to sort of make it our own under the circumstances, but we're still committed to following the MEPS, the minimum elements and practice standards. But the public engagement was a real question here. How do we engage people when we couldn't get to them? It was hard to organize. And since this time, there have been multiple sort of research in terms of like, and work more on how to engage people virtually and things like that, but this was still in the early stages. So we really question this. One of the things that we're able to do through the technical assistance side of things was to conduct a few focus groups with some community organizers that help provide feedback. And we also accessed historical meeting information with the public to be able to at least represent what they had said in past venues during the implementation of the HIA. There were some relatively open meetings to also gain other feedback, but we were sort of in this consult version of this spectrum of public participation that the International Association of Public Participation came out, where we wanted to obtain their feedback and then let people know how we're going to use that to influence the decision. And largely that's in Rockford's arena as they move forward with their redevelopment plans, but that was the capacity we had for that. And it's important to understand that there are different levels of engagement. I won't go into all the details of the assessment step, but the assessment is where the data analysis and collection happens. So an HIA is not a soft form of risk assessment. It can be as quantitative as you want it to be. If you have exposure models, data mining, citizen science sensor technologies, statistical evidence, anecdotal stories, any type of information could be included so long as it's sort of reasonable in terms of informing the decision. But looking at number 4, the second one here, all sorts of evidence could be used in an HIA, and it's done in the assessment start. And you should acknowledge all of the uncertainties associated with whatever approaches you are taking. But so long as your information is supporting the decision, it's okay to use it. In terms of the South Main Corridor, we looked at 3 census tracts primarily, with 27 and 28 being the most populated. And because the neighborhood revitalization was a fairly broad approach, we looked at a broad set of indicators to establish the baseline conditions of the community. These socioeconomic indicators you see on the right-hand side, various types of public health indicators. And what I mean by indicators are data sources, metrics that could support things like health, like measuring health outcomes, unhealthy behaviors, and health prevention activities. So actually finding data on the prevalence of smoking, the prevalence of physical activity, of asthma or heart disease incidences, and really leveraging the mental health focus from a local planning council survey, as well as the CDC 500 cities. And the thing about doing a baseline like this, it allows you to sort of look at what's going on in the area. So we found that Spanish is spoken at over half the homes, and many of the homes also are low income and single parent households. So this was actually not the magnitude of the Spanish speaking homes was a new information for the city of Rockford to really understand that that's a very, very important component of this. They knew it was a primarily Latino community, but the actual amount of Spanish spoken at home and knowing that approaches should be targeted to that was more insightful given this analysis. And then we went into each of the health determinants that I mentioned earlier, and I won't go through each of these in detail, but the sub bullets under them, housing access, affordability, quality, those were the metrics that we tried to find information on, like the age of the housing. And here in the blue on the bottom are just a couple of the example strategies or quote recommendations that were based on the findings of some of this information. So developing supportive housing for seniors and physically disabled, but also to provide outreach to raise awareness of housing rights in languages and materials that people would be able to understand would be very important. Looking at things in the neighborhood and built environment, such as access to goods and services and transportation options, and considering mixed use development in terms of moving forward, but also appreciating the historic underpinnings of the area as well, and frankly the current local community pride and traditions and cultures that exist there, and really being able to support those. Looking at parks and green space, what are the current conditions on access to parks and green space? What are the park conditions? What are the recreational opportunities because of the riverfront? Providing different strategies on being able to increase access to green space, for example, during the redevelopment, such as by redeveloping vacant lots. In terms of employment and economy, how could neighborhood revitalization potentially impact employment and economy? What would be some of the baseline conditions we can look at now? And then subsequently, after implementing some of the strategies, could we potentially measure those impacts into the future? Similarly for crime and safety and social and cultural well-being as well. And admittedly, the social and cultural well-being, we're looking at information on things that have occurred in the neighborhood, on examples where folks have built a community center, have taken advantage of things. So you have to be creative in some of the metrics and indicators that you look at, but they're out there. So as the assessment moves forward, you start to look at this data and information, there's definitely a question of how do you use it? And that's where some of the recommendations come in. So recommendations should consider not only mitigation of adverse effects, but also enhancing health benefits. And that's one of the important messages to take away from HIA. It's an optimization of public health. You have your decision, it's being considered. You may have some leeway in terms of what you can do, some alternatives you can take. And the idea is how can we enhance the benefits and decrease the negative aspects? And who would we work with to be able to do that? So from Rockford, we were able to develop 81 strategies across the 6 health determinants within this neighborhood revitalization context with a special focus on mental health. And even though 81 may sound like a lot, but as you can see, you look at housing, accessibility, and there are multiple strategies to look at through there. These are fairly easy to look through, and I'd argue that a person within, say, a city planning could look at some of these and say, hey, that's something we can do right away. that's something we can't do. This is something we'd like to look into more fairly quickly. So in terms of the reporting step, again, making this information available to your stakeholders in a way that they understand and can participate as you laid out initially in the scoping section in terms of the decision-making process. So in terms of reporting for Rockford, we're kind of at this stage where the actual final HIA report is under external peer review so that we'll be able to post it publicly. So that's underway. We're also developing many of the underlying health determinants into a story map, which is sort of an online, easy access table of contents type of approach to providing more of the succinct information on the health determinants and their impacts and their solutions. Working with Anne in the Office of Brownfields, we're developing some of these more one-pagers on these health determinants like housing and neighborhood revitalization or housing development and brownfields. How can we take what we learned from Rockford and translate that into more manageable materials for the broader stakeholder community across the country, for other cities who are interested in neighborhood revitalization, for example? And also currently, before the end of the calendar year, working to develop a monitoring plan to kind of look at how some of the decisions based on the HIA may manifest into the future and how we plan to follow up on that. Yet another point of HIAs is the follow-up. You're not done when your data analysis is complete, scientists. So in terms of evaluation and monitoring, I often say these in one breath. They really should kind of have their own thing. But in terms of the evaluation, you can evaluate how well the HIA process itself worked out, and then you can also measure evaluate the impacts of the HIA in terms of its impact on the decision-making process. And then monitoring, as I mentioned, is sort of looking at the long-term effects of the strategies that you've implemented. So again, evaluation and monitoring for Rockford, we are currently developing that follow-up plan in order to measure the impacts of the HIA, both near and long-term, direct and indirect. And this is just an example of some of the indicators that we may look at for some of the things, understanding that the data sets will not always capture the granularity of a community-based redevelopment. So wrapping up here, some of the HIA success in terms of considerations, like when you do an HIA, what helps make it actually work in the end in terms of getting your value out of it. This is from a review that CDC did of multiple HIAs, and some of the impediments of an HIA being successful, again, are that it's completed too late before it could impact the decision-making process. Also the adequacy of resources. But again, I'd argue that you make it your own and you can apply the resources that you have and do your best, and you can still work through an HIA. One of the main things is the lack of support from decision makers or the involvement of decision makers, especially initially in the process, to make sure that the people who are actually changing their actions to improve public health, or whatever that is, whether it's someone making a permitting decision or whether it's a personal behavioral decision that people are making, but understand keeping them involved in the process so that this doesn't just sort of blindside them when you come out in the end. And sometimes, no matter how good it is, if they're not engaged, they're not going to buy in. Some advantages to it are definitely engaging those stakeholders, especially the community, but also different private and government sectors, and really coming up with clearly articulated, feasible, that being the operative word, recommendations, or what I call strategies, so that they're not so, they don't have the connotation of being told what to do, but optimizing what you are doing, and having clear and effective stakeholder communication. The last two slides here are just to highlight, and these have been shown before, there are resources out there. There are ways to look at these. Some resources can help you go deeper into each of the steps, or you can look at this Pew Trust database on HIAs, where they have several examples of HIAs that can be done, and you can search by the different sectors or health drivers to look for ones that may be related to what you're doing, and to get some ideas and examples and to see what people have done to help support what you'd like to do. So in conclusion, not so much takeaways, but really just to beg these questions in terms of folks thinking about maybe stepping into the HIA, is an HIA a practical use of my time and resources? Is it too complex to make timely decisions? Will it benefit or burden decision making? These are things where they can be challenging for any new process, but I've been doing this for a fair amount of time in various types of capacities, and I will say that it is possible. And it is also possible, HIA provides a table for people to come to. And it is possible to move forward with cross-cutting solutions, as long as people have a framework that is appropriate for them to be able to have that discussion. And I'll add here that cumulative impacts and environmental justice are inherent in the HIA in HIAs. If you're doing HIAs sincerely, we're taking the minimum elements and practice standards seriously, you are addressing cumulative impacts and environmental justice. Thank you very much for your attention, everyone. And I believe we're going to move into the Q&A part.
Yes, we are. Thanks, Tim. And thanks to all of our presenters for a great presentation so far. And thanks to everybody who has submitted questions. We're going to go into the Q&A here. And you can continue to submit questions through the questions tab. And we'll get through as many as we can for the next about 30 minutes or so. And I know we got a couple comments about troubles with the links. So if anybody is having trouble with that, let us know and we'll check on those. There is also a handout, as you can probably see in the chat as well. And then all of the information from today will be posted on our webinar archives page in the next couple days. So you'll be able to visit that. We'll send out an email to all the participants today. Once that's been posted, you'll be able to see the resources that are there. And then also, just as a reminder, hopefully a number of you have been part of the other programs in this series. All of the information from all the programs are posted on that webinar page as well. So as we move forward, I think it's become a good resource relative to what's been going on across the country in a number of these communities. So with that said, welcome presenters. Thanks for turning on your cameras. Got a number of questions about the process and about how to do this, etc. Not surprising given our topic today. So I'll start with this one, and I'm not sure who wants to take it on first, but question is, what's kind of the difference between health impact assessments, environmental impact assessments, and social impact assessments? How do those kind of fit with one another and what we're talking about today? I don't know.
Sandra?
And are you? Okay, go ahead.
I can take a shot at it. It's EIA. What was the other one?
Social.
Oh, social.
Yeah, social and environmental impact assessment, SIA, EIA.
So health impact assessment focuses primarily on health impacts, right? On humans. Environmental impact assessment primarily looks at the environmental impacts on the ecology, on different ecosystems, right? There is a line in the NEPA bill that says and human health, but usually it doesn't focus on human health. And then social impact assessment, it's while the steps of social impact assessment are very similar to the steps for HIA, I would say that it is broader than health, right? It's more of your sociocultural context and impacts. And EIA is very, very stamped out. It's very engineering focused, whereas SIA and HIA are more social science based. Not that all of the techniques you would use are social science techniques, certainly, but they're more social science based. And HIA looks at the social, economic, and health impacts, right, of those decisions and their impacts on health. So I think that social being very much broader, human health being the focus of HIA, and then the environment being very much the focus of EIA.
Great, thank you. Thanks for that clarification, especially for folks who've worked in one of these areas or are interested in it. And actually, I guess in that realm, we've got a question here is, where can one get best trained to become an HIA practitioner here in North America?
Perhaps as the society executive director, you might mention that.
Yes, at the Sophia Practitioner Workshop, which we have traditionally hosted once a year, we always offer an in-person training. We have done online trainings as well, and those are on a case-by-case basis, but at least once a year you could get it at the Practitioner Workshop. And you can also email me and I can put you in touch with a consultant who also does the training.
Great, thank you.
I would also invite folks to dive in, open up the minimum elements and practice standards, and look at the whatever is coming into your head about like, oh, this is interesting. I wonder if we can use it for this. You know, open up those MEPs and see which ones do align, and some may align much more easily than others, and that's sort of a foot in the door to just sort of begin the process and begin that learning process and begin that, you know, understanding where to go for the informational and educational resources that you're going to need. And there's a pretty supportive community out there, and HIAs have been this type of HIA, this sort of 6-step process has been being done for a long time now across sectors across the country. So there's help out there, but just get in there.
I agree, Tim. I did the same thing, right? Whenever I learned, there wasn't the minimum elements yet, so I got a mentor, someone who's done it before, and it's not rocket science, right? There are guides. Sophia has guides on our website. The minimum elements are there. There are also more detailed step-by-step, and they're resources on the website. There's recordings. There's a lot of resources out there on HIA. EPA has resources. If you're at a health department, you can access the ASTO and NACHO resources. The National Environmental Health Association has resources. CDC. I mean, there's a lot of material out there.
I would also say, for those of you who care to join us, we will be organizing a health impact assessment conversation at the next National Brownfields Training Conference, which will be in Oklahoma City sometime to be announced in 2022. So do join us and learn from the experts.
Great, thanks, Anne. Here's the next question from Stephanie Weigel, who's asking, are health impact assessment techniques ever used to establish health baselines proactively or most commonly in response to proposed projects?
I think I understand the question, but the health impact assessment is intended to be a proactive assessment prior to the program, policy, or decision. Again, traditionally and conventionally, so that the findings of the HIA can inform that program rather than a retroactive analysis of health impacts. So I think that's the initial question. But what am I missing there, Sandra?
I think, you know, maybe the confusion is around, you do have a baseline of health impacts, health outcomes that you look at in an HIA, but they are usually restricted to that decision, that policy, program, or project that you're looking at. You don't usually just do a baseline, you know, outside of that, unless you're doing some other process, I think.
Right, that might be more a community health assessment or some other kind of activity.
Mm-hmm.
Anyway, you might want to contact us separately from this to discuss further.
Yeah, our neighborhood revitalization HIA, because it was a fairly broad kind of approach in terms of what was going to be happening. As mentioned, you know, we took that broad look at the baselines, but the baselines could be more targeted to the potential impacts of the decision. But I think one of the goals of that baseline is to at least understand, you know, what are the current conditions and what are some of the things we might expect to change in the future? And then ideally, could we measure some of those changes? So one of the points of the baseline in HIA is to be able to look at the impacts of the decisions and the strategies that you implement because of the HIA. Now, as mentioned, some of those baselines might come from like national data sets or something, and I think there's some, there's a level of, if we implement a smaller scale decision, we may not see that reflected in this big data set, but that's okay because you acknowledge that uncertainty based on that finding. But I think that's what largely the baseline is for.
And I mean,
oops, looks like you might have frozen Anne.
I didn't freeze her. She froze herself.
Okay.
I think it's that
I don't know, Anne, if you're having issue with Microsoft Teams. It may be freezing you occasionally.
I turned it off, but.
Okay. Anyway, we missed what you were saying if you were just adding to that last response.
Okay. Don't worry about it.
Okay. Well, we'll move on to the next question here then. Okay. And that is, are there processes or types of projects within which HIAs are mandated to be done?
I think there are states that now require HIAs for certain activities, but I'm not, familiar with the latest of their state legislation.
The short answer is no, not in this country. There are, as Anne mentioned, there are some like cumulative impact considerations and ordinances, for example, cumulative impact ordinances related to permitting that are being considered by cities and states. Some of those are using HIA approaches to help identify how they're going to do that. So it's being explored, I think, more as a process to look at cumulative impacts, look at tangible ways of moving the needle on environmental justice across sort of a spectrum of these policies that are being supported now in terms of, the economic redevelopment, for example. So I think there are some policies and regulations that have some wordings that are somewhat reflective, lots of hand waving here, of HIA processes. But in terms of really informing a decision, not necessarily, not like what's being done at like the Impact Assessment Agency in Canada, where their sort of order of business is to follow basically a 5-step HIA process within the environmental impact statements that they do and things like that. But it's a larger scope on health, and it's a process that guides like that entire agency. And I'm not familiar with sort of federal or local governments that follow it to that, level of consistency and rigor.
Certainly it's not to that level, but the state of Massachusetts requires an HIA-like process for all of their pedestrian and bicycle infrastructure funding. And there were 2 states that were experimenting with the health impact review of legislation. Those were Oregon and Maryland. Maryland is still running their experiment with it. Keisha Pollock Porter from Johns Hopkins is actually the key person on that one. But there have been other jurisdictions that have required HIAs of a type. The state of Alaska requires HIAs on oil and gas drilling permits. There are a couple of other jurisdictions, Shelby County in Tennessee, as well as the Nashville Metropolitan Planning Organization also do HIAs on their larger projects. But it's not systematized across the country. Like, you just have to know those things, right? Or know someone at one of those organizations to know that.
Okay, thank you. Next question here is from Nina Amon, who's asking, I work for a county DOT reviewing land use applications. Is there one component or area of HIA that would be useful or could be utilized for incorporating a public health benefit from the transportation realm?
Hi, Nina. Good to hear from you. HIA has primarily been used on transportation projects. If you look at the early HIA projects, go to the Pew Health Impact Project page, all of the early HIAs were on transportation. And I think that the indicators and the outcomes for transportation are well established. Andy Dannenberg actually has written a paper looking at the metadata around transportation HIAs, and I'd be glad to send you those links.
And I think too, looking at some of those minimum elements and practice standards, and maybe understanding, you know, which aspects of each step could potentially fit into transportation planning decision. And kind of what I mean by that, and I'm not sure if this is what the participant was asking exactly, but this is something I see in Office of Research and Development in terms of when we consider HIAs in our research is, one can't necessarily only do like one step of an HIA to say, oh, I'm doing an HIA, but I'm just doing the assessment step of it, but I am following the MEPS for that. That doesn't qualify as an HIA. It would be more representative to make sure you cover each, you know, kind of to the best of your ability, or to acknowledge, I mean, at a minimum, acknowledge what's happening within that step, whatever can or cannot be done. You know, does your project address this engagement aspect, this community engagement aspect? If not, why not? Can it? You know, start to work through each level, and you may find yourself going deeper into like one step, but you don't want to do one step or two steps at the exclusion of the others, because one of the whole points of the HIA is the process. So if you're sort of not actually doing, you know, main parts of that process, then you're sort of not really fulfilling that requirement of like, you know, a true HIA, if that makes sense. And one of the things too that we're working with Ann with in Brownfields is to apply HIA in some situations like in Rockford, but then to really try to develop these concise approaches that folks can follow without having to worry about stepping through each part of the HIA, but really to give them what we have found, you know, about like housing and land revitalization in a neat package that they can kind of work through each of those steps, even just in their, you know, planning process, without, again, having to reference the MEPS for great detail. So really translating and providing these, you know, consolidated materials, I think is a big opportunity moving forward.
Great, thank you. Next question here is, what steps or strategies can be used to engage local elected officials when the community's desire for an HIA is a higher priority than that of the local government?
I think sometimes it's really actually talking to other local government leaders who have been participated in the process. I know of the 2 HIAs I've worked on with our Office of Research and Development, the local leadership were really thankful that we had done the health impact assessment, and also had them, it resulted in them really looking at their core work in a very different way. It opened up new solutions, and it really deepened their own understanding of their community. So I think maybe the best way is really talking to other leaders that have been a part of a HIA and get them to peer talk to each other, you know, peer counseling. I don't know if there's such a thing with Sophia, but, you know, getting that other political support for it might be really important.
I think too, working with your health department. The health department has traditionally been what we call a non-political convener, right? So getting them involved and getting them to talk to your local elected officials can be a great way. Providing some education for your local officials about what an HIA is and what it can do. Even just having the community member go in and talk to them about why it's important. Sometimes that gets you somewhere. Sometimes you have to have other allies in the community, get the business community on your side. You know, once you connect with the health department, they often have connections into the business community or into other sorts of local leadership, like civic organizations, that could be helpful and supportive as well.
Right. The other thing I would just mention, it's not an HIA, but it might be useful in your area, is there's a requirement now for certain nonprofit hospitals to do what is called a community health assessment. And it's their requirement because they have a nonprofit status. So they are meant to look at what is the community health in their area, their catchment area for the hospital, and then what are the community needs so that they can better serve the community. And that's, you know, it's an IRS requirement. So that might be something to think about if there's nearby community health needs assessments as part of your hospital systems.
Also, in terms of, you know, that's a good question, though. I mean, engaging, you know, how do you engage reluctant stakeholders? You know, sometimes you have to speak their language too, right? Some of these projects have benefits as well, and those are, you know, subsumed under perceptions of risk or actual risk. But there could be benefits to decisions as well, and HIA provides a platform to expound on them, to not only advertise the good things about a project, but to also help folks identify how to make those things better, which I think could increase relations across the board. So, you know, speaking to the benefits of, you know, jobs and employment and, you know, local economy, understanding that that could be separated from the community perspective, okay? But there are benefits there, and to explore those could potentially help bring people to the table. But another thing that's super important is managing those expectations about what can be done. The community needs to know, you know, what are the alternatives to the decision that's being explored with the HIA. You know, are we going to do the whole HIA and it's not going to change anything? They need to know, you know, are there alternatives to what can be done? Is there room to modify our approach? And how are they going to be at the table? How are any of the people in the HIA going to be at the table to influence that decision? All the people need to know that. The private interests also need to know, is this HIA going to force my hand to do something that I was not wanting to do in the beginning? You know, I signed on to this in good faith, and now we're moving through it, and people are expecting me to do something I never signed on for. Those two things, I think, you know, highlighting some of those benefits to get folks at the table, but really managing those expectations about what an HIA can do are so important, you know, right at the get-go. But that's, you know, one way to help bring some of those stakeholders to the table.
Great, thanks, Tim. Next question may be somewhat related. My state did a great job with HIAs when federal funding was available, but when the federal funding stopped, so did, for the most part, the HIAs. How can we get these included as a component in more capital projects and land planning projects?
One of the challenges with HIA, if I can try to tackle this a little bit with my scientist shoes on, not my capital funding shoes. I don't have those. Is that again is partly, you know, how are the HIAs going to influence those decisions? I think that would just be one of my initial reactions to that question, is to say we want to move into an arena where policies can consider broader health impacts, but in terms of applying that and moving through with, you know, legislative, this is different than legislative processes, but it's a you're dealing with, I think, very similar actors in terms of allocating funding, resources, assigning contracts to different things. I mean, when you talk about mitigation, there are still bulldozers and things like that involved, and those decisions, you know, can be informed. I think if an agency, if city agencies, for example, or state agencies are willing, like Sandra had exemplified, are willing to use HIA, you know, like, and test it out and see if this approach is fitting in, if the decision makers are willing to, you know, apply that process, number one, there's support out there for them to do that in terms of the field and the community. And number two, I think they're going to be forging a trail for how we are going to do this. I think some people have to get their, take that step and say, we're going to try this. HIAs are not necessarily easy. Let's make this clear. Like, these can be a challenge, but the more you do them, the more you see what's going on, the more you put the pieces together. And so I think there needs to be some, initial buy-in from the decision makers at those levels, to try to consider some of these and to apply them, and then to really show what the benefits are, so that others can start using them. But really, you'd be trailblazers. I mean, I invite folks to do this.
I think too, since we have the EPA on the line, it would be really helpful if federal funders would put some teeth behind it, right? There was a time when EPA would pay for HIA out of a Brownfields project. I actually did 3 of those, I think. And, now the rules just keep changing and getting tighter. So with some of the ARPA money and some of the new money that's going to be coming down, I think we have a great opportunity for not just EPA, I was picking on you guys, but for DOT, for HHS, right? As they are pushing this money down into communities to put some oomph behind HIA, to put a requirement anytime you're doing a large federal outlay to communities, to make it clear that this is important and that this needs to be funded. But I think failing that, look to your community organizations, look to your hospitals. There are also hospital and local foundations that will fund these projects. Look to your United Way for training and for opportunities to work with nonprofits. I mean, there are a lot of ways to get these done in your community without a lot of money. You just have to have the right partners who are willing to invest staff time and their own capital. And I don't mean cash capital, I mean their clout and their resources that they intrinsically have in the process to make community better.
I would also say, since Dr. Whitehead is also a professor at GW, there are graduate students every year that are looking for projects, and there are, in fact, examples of student-led HIAs or HIA lights. So that's an opportunity, as well as she mentioned earlier, there is language in NEPA, and environmental impact assessment is meant to be talking about human health impacts. And so maybe you can, open that door a little bit more to get some of the health considerations that you want reflected on those bigger capital projects. But whole of government is absolutely the way to go. Thinking about HUD, thinking about Department of Transportation, just because, as well as Department of Interior and other large resource agencies, USDA, Rural Development Agency, EDA, they have resources for big capital development projects, and they have to require and meet NEPA requirements. So that is an opportunity, working with those state and local NEPA officials as well.
Great, thanks, Ann. Given the volume of questions, I'm going to ask just a couple more, and then we'll wrap up. And the next one is there a minimum scale of project where HIA is applied? It sounds only like larger transportation projects apply.
I've seen them done on small neighborhood, like extension of a road, realignment of a road. I don't think that there's a minimum amount of the project that how much you're going to spend on the project. I would say it's the impact, right? The scale of the impact is usually what drives it. Is the impact deep in the community? Does it only affect certain members of our community? Is it specifically aimed at, a particular part of the community geographically? I think it's the impact and the severity that really drives whether or not you do an HIA a lot of times, rather than the amount of the project.
Okay, thank you. I guess in the interest of time, I'll ask this last one quickly. Does one need to be certified as an HIA practitioner to conduct the HIAs? In other words, is HIA practice regulated, and if so, how?
Gosh, no, join the club, please.
Yeah, there's no licensure. We ask that people self-govern themselves, that you use the minimum elements and practice standards and not call something that isn't an HIA an HIA. And we'd love it if you'd publish it so that we can all read it.
Yeah, and in a self-compassionate sense, give yourself a break. These things don't always go smoothly, but if you're trying, I mean, you're learning and things are happening. But allow yourself to just explore the process and work through it. That's all, and just do the best you can. I think that's all HIAs ever ask of people, really.
Right, and help educate the community about where there are other things that they really can control and make a difference with.
Great, thanks, Ann. And as usual, we could go on a lot longer with the Q&A, but we've run out of time. So I just wanted to give each of our speakers a chance to give us some final thoughts and takeaways from today's. And I guess we'll start with Tim on this.
Thank you. Well, I present mine as more of a question to the participants. What do you think of HIA? When you think of HIA and you heard these presentations today and the work that you do, what do you think? Send me an email. I actually would love to hear it because, the Office of Research and Development where I am is very interested in this. I'd love to hear your perspective. What you heard today. Do you think it could work? Do you think it cannot work? I want to hear, your perspectives. So that's that thought. And my final thought is, if two people from today go and check out the MEPS and one person decides to kind of implement that in the future, that would make me feel great. And if you're that person who does that, please, contact me as well. I'll be working on stuff like this for a little while. So please contact me and let me know if you implemented something, based on what you heard today. And that's all I have. Thank you.
Great, thanks. Dr. Whitehead.
I agree, Tim. I think if one person picks up the minimum elements out of this, I'll be happy. But I am looking for a project for my HIA class next summer. So if you want to dip your toe in and work with some students, it doesn't matter where you are, we can meet with you virtually. And I also want to give another plug to the Sophia Practitioner workshop happening tomorrow from 11 to 1 if you're interested in learning more about the future of HIA.
Thank you. And we'll give Ann the last word.
Wow, that's scary. So I just want to thank University of Maryland and all of you who have given your time to share with us this webinar, especially Dr. Whitehead and Dr. Barzak and my colleagues in Chicago who have helped organize this webinar series that has taught us all so much. We're excited to use health impact assessment as part of Brownfields, but we're also very, we're respectful of the community. And so if they don't want to do a health impact assessment, but they want to do some other kind of health assessment, that's really up to them, and we're there to support them. So this is a whole of government approach. We're excited about using it with us and our partners. And I guess with that, I would just like to say thank you for joining us today. Happy holidays, and we look forward to reconvening this webinar series in January. And so stay tuned for future webinar announcements.
Great, thank you, Ann. So with that, we're going to conclude our webinar using health impact assessments to engage communities and prioritize action. I'd like to offer a great big thank you to our panelists for a great presentation, to everyone who attended today, and to John Coleman, our communications and technology guru who helps to make this all happen. The complete recording of today's webinar will be posted on smartgrowth.org. Also, for those of you who have requested one, all attendees will receive an email that will contain a link to a personalized certificate of participation. Please look for this follow-up email, especially if you need that to claim other continuing education credits. When you exit from today's webinar, you'll be asked to participate in a short evaluation. Please take a few moments to provide feedback so that we can continue to improve the webinar experience for you. Finally, as Ann said, please keep an eye on smartgrowth.org and your email inbox for details on other future webinars. We're about to send out a notification about one next week, and we will be sending out information about programming in January soon as well, including the next program in this series. With that, we wish you all a great day.